A cranial remolding orthosis is a helmet that is fit on babies. It's fit typically between the ages of 4 to 9 months, and the baby wears it on average 4 to 6 months. It's used when a patient has a flat head. It could be plagiocephaly or brachiocephaly. Those are the two most common scenarios that we see. Plagiocephaly is when one side of the head is flatter than the other. Brachiocephaly is when the whole posterior, which is the back side of the head, is flat. Measurements are used to determine if the baby qualifies for the helmet. We take one measurement, which determines asymmetry, which means it'll tell us how flat one side is compared to the other. If it's a certain number of asymmetry, they will qualify for the helmet. Also, a patient can be qualified if their cephalic ratio, which is basically the shape of their head. We like heads to typically be a little bit longer than they are wide. So if the patient has 100% cephalic ratio, that means that their head is the same length as it is wide. So that patient would qualify for a helmet because we like the head to be a little bit elongated. There's a scan taken of the head, and this is created into a 3D model. This 3D model is then corrected into the final shape that we want the head to be in. The helmet is fabricated over this corrected model and then fit onto the baby's head. Within the helmet, there's space that we want the head to grow. On the flat areas, we want the baby's head to grow into those areas. So within the helmet, there's empty space. There's also areas of the helmet that we hold where the inside of the helmet is touching the patient's head so that it doesn't grow in those areas.